Did you know that one of the greatest threats to our health could be silently accumulating in our arteries right now? Yes, we are talking about atherosclerosis, a complex and often deadly condition. Atherosclerosis, or the hardening of the arteries, is characterized by the buildup of plaques primarily composed of fat, cholesterol, and other substances. These plaques can restrict blood flow or rupture, leading to potentially fatal events such as heart attacks or strokes. Before we begin, don't forget to subscribe to the channel and hit the notification bell. Nearly 90% of people who watch our videos every week forget to subscribe to the channel and therefore don't receive our videos with tips and plenty of health information that could save lives. Recent investigations point to a ray of hope in the fight against this condition. Increasing certain vitamins in our body can not only prevent the formation of these dangerous plaques, but also reduce the existing ones. The relationship between vitamin deficiency, calcium, and atherosclerosis might be the key to unlocking a longer, healthier life. Stay with us and discover how a simple change, such as vitamin supplementation, can not only clear your arteries, but also significantly reduce your risk of death from atherosclerosis. Arterial calcification, also known as calcified atherosclerosis, is a process in which calcium deposits form in the walls of the arteries. These deposits are not merely calcium buildups, but are part of atherosclerotic plaques that include fat, cholesterol, and other cellular debris. Over time, these plaques harden and restrict blood flow, significantly increasing the risk of cardiovascular diseases such as heart attacks and strokes. Calcification can be seen as a marker of arterial aging, but its impact on health is profound. It can reduce the elasticity of the arteries, preventing them from expanding properly in response to increased blood flow. This can lead to hypertension and reduced oxygenation of vital tissues. In severe cases, it can cause complete blockages, resulting in damage or death of the tissue that depends on the affected artery for oxygenated blood. Furthermore, the presence of arterial calcification is an indicator of advanced arterial disease and can be used to assess the risk of future cardiovascular events. Doctors often use arterial calcium scoring, obtained through computed tomography scans, to evaluate this risk and guide treatment decisions. The good news is that lifestyle changes, such as diet and exercise, along with medical treatments, can help control the progression of arterial calcification and reduce the risk of serious complications. Magnesium plays a crucial role in cardiovascular health, especially in regulating calcium inside and outside cells. This essential mineral acts as a natural antagonist to calcium. While calcium promotes excitation and contraction, magnesium promotes relaxation. This balance is particularly important in the arteries, where the proper ratio of calcium to magnesium helps maintain arterial flexibility and prevent vascular stiffness. In the context of arterial calcification, magnesium helps prevent calcium from depositing in the walls of blood vessels. Studies suggest that adequate magnesium levels can prevent or even reverse the process of arterial calcification. For example, magnesium may help dissolve existing calcium phosphate crystals in plaques, thus reducing the hardening and narrowing of arteries. Moreover, magnesium also helps improve endothelial function, the ability of the blood vessel lining to expand and contract as needed. This is vital for regulating blood pressure and preventing blood clots. Magnesium supplementation, when indicated, can help restore these vital functions, especially in individuals who are deficient in this mineral. Therefore, maintaining an adequate level of magnesium can be an effective strategy to combat arterial calcification and promote better cardiovascular health. Adequate magnesium intake can be achieved through a diet rich in leafy green vegetables, nuts, seeds, and whole grains, or, when necessary, through supplements. Magnesium deficiency is intrinsically linked to various health problems, including chronic inflammation and endothelial dysfunction, two critical factors in the development of cardiovascular diseases. The endothelium, a layer of cells lining the inside of blood vessels, plays a fundamental role in regulating blood pressure, blood clotting, and overall vascular health. When magnesium is deficient, several negative effects occur in the body: oxidation and cellular stress. Without enough magnesium, the body may experience an increase in oxidative processes, contributing to more damage and aging of endothelial cells. Therefore, magnesium supplementation can play a significant role in the prevention and treatment of chronic inflammation and endothelial dysfunction, especially in individuals at risk of deficiency. However, it is crucial to consult a doctor before starting any supplementation, as magnesium can interact with certain medications and health conditions. Endothelial dysfunction. Magnesium is crucial for endothelial health, helping to maintain blood vessel dilation, facilitating adequate blood flow, and preventing clot formation. Magnesium deficiency can lead to impaired endothelial function, resulting in stiffer blood vessels that are less able to adjust to blood flow, increasing the risk of hypertension and other cardiovascular problems. Reduced kidney function. The kidneys play a crucial role in regulating magnesium levels, but their efficiency may decline with age. This can result in increased magnesium excretion in the urine, leading to decreased levels of this essential mineral. Medication interactions. Many elderly people are on long-term medical treatments that include diuretics, antacids, and medications for hypertension, which can interfere with magnesium absorption or increase its excretion. Dietary and absorption changes. With age, dietary magnesium intake often decreases due to changes in eating habits and less variety in the diet. Additionally, the ability to absorb magnesium from the digestive tract may decline with age, exacerbating the risk of deficiency. Chronic inflammation. Magnesium has natural anti-inflammatory properties. Lack of this mineral can lead to an elevated inflammatory state, which is a known precursor to various chronic diseases, including atherosclerosis. Chronic inflammation damages blood vessel walls and promotes plaque development. As we age, our bodies face greater challenges in absorbing and storing essential nutrients, including magnesium. In people over 70, magnesium deficiency becomes particularly concerning due to several factors, including dietary changes, decreased kidney function, and common use of medications that can deplete the body's magnesium reserves. Magnesium deficiency in the elderly is associated with various health complications such as osteoporosis, heart disease, type 2 diabetes, and even mental health issues like depression and anxiety. It is also linked to increased systemic inflammation and endothelial dysfunction, which can accelerate the process of atherosclerosis and other vascular conditions. To combat magnesium deficiency in this age group, it is essential to promote a diet rich in magnesium-containing foods, such as leafy greens, nuts, seeds, and whole grains. Magnesium supplements may be recommended, but they should be administered under medical supervision to avoid excess and drug interactions. Vitamin E is widely recognized for its powerful antioxidant properties, which play a crucial role in protecting the body against free radical damage. This fat-soluble nutrient offers several benefits for cardiovascular and overall health, especially in the prevention and management of chronic diseases. Protection against LDL oxidation, bad cholesterol. Vitamin E is particularly effective in preventing LDL oxidation, which is a critical step in the development of atherosclerosis. By preventing this oxidation, vitamin E helps reduce plaque buildup in the arteries. Improvement of arterial health. Studies suggest that vitamin E can improve the endothelial function of arteries, thus facilitating better blood flow and reducing the risk of thrombosis. Reduction of inflammation. Vitamin E has anti-inflammatory properties that are vital for reducing systemic inflammation, a known factor contributing to atherosclerosis and other cardiovascular conditions. In addition to its effects on heart health, vitamin E has also been associated with protection against certain types of cancer, age-related macular degeneration, and even neurodegenerative diseases, such as Alzheimer's disease. It is important to obtain vitamin E through a balanced diet rich in sources such as nuts, seeds, vegetable oils, and leafy green vegetables. Vitamin E supplements are also available, but they should be used cautiously, as high doses can have adverse effects, especially in individuals with certain health conditions or those taking specific medications. Promoting adequate vitamin E intake can be a valuable strategy to improve overall health and prevent chronic diseases, but it is always advisable to discuss any supplementation with a healthcare professional. Low levels of vitamins B6, B9, and B12 are associated with the formation of atherosclerotic plaques. Vitamins B6, B9, and B12 play essential roles in cellular metabolism, particularly in the metabolism of homocysteine, an amino acid present in the blood. High levels of homocysteine have been associated with an increased risk of atherosclerosis due to its potential to damage arterial walls and promote inflammatory processes and plaque formation. Vitamin B12, cobalamin. Vitamin B12 is another nutrient that interacts with homocysteine, facilitating its conversion into methionine, another beneficial amino acid. B12 deficiency, common in the elderly and in people with diets restricted in animal products, can lead to homocysteine buildup. Additionally, B12 is essential for nervous system health and blood cell production. Vitamin B6, pyridoxine. Vitamin B6 helps regulate homocysteine levels in the blood. B6 deficiency can lead to increased homocysteine levels, contributing to the development of atherosclerosis. Furthermore, B6 is vital for immune function and hemoglobin formation. Vitamin B9, folate. Folate also plays a critical role in homocysteine metabolism. Studies show that adequate folate intake can significantly reduce homocysteine levels and, consequently, the risk of atherosclerosis. Folate is equally important for cell division and DNA formation, being crucial during pregnancy to prevent neural tube defects in fetuses. Vitamin D3, also known as cholecalciferol, is essential for several processes in the body, including the absorption of calcium and phosphorus, which are crucial for bone health. Additionally, vitamin D3 plays an important role in cardiovascular health and the prevention of atherosclerosis. Endothelial function. Vitamin D3 is important for maintaining endothelial function. The endothelium is the layer of cells that lines the inside of blood vessels, and its health is vital for preventing atherosclerosis. Vitamin D deficiency has been associated with impaired endothelial function, which can contribute to arterial narrowing and hardening. Reduction of inflammation. Vitamin D3 can reduce inflammation in the body, a known risk factor for the development of atherosclerosis. Studies show that adequate vitamin D levels are associated with a lower incidence of chronic inflammation and related diseases, such as cardiovascular diseases. Impact on blood pressure. There are indications that vitamin D3 may help regulate blood pressure, possibly through its effect on calcium and vascular smooth muscle function. Given the importance of vitamin D3, it is vital to ensure adequate intake, whether through sun exposure, fortified foods, or supplementation, especially in regions with little sunlight or for people with darker skin, who have greater difficulty synthesizing vitamin D naturally. Supplementation should always be done under medical guidance, as excess vitamin D can lead to adverse conditions, including hypercalcemia, which can negatively affect the heart and kidneys. Calcium regulation. Vitamin D3 helps regulate calcium levels in the blood by promoting calcium absorption in the intestine, but it also helps ensure that calcium is deposited in bones rather than accumulating in arteries, preventing vascular calcification. If you have anything to add, please share with us in the comments. Don't forget to subscribe to the channel. I'm leaving 2 videos on the screen that I'm sure you'll like. I'll see you there.